There are few iconic stories about moments that changed the course of medical science. Alexander Fleming's discovery of penicillin in 1928 in a Petri dish. There was the discovery of insulin, the invention of the X-ray. But here in Australia, just outside Melbourne, after World War II, an Australian psychiatrist called John Cade made his own enormous discovery, which changed the course of mental health treatment forever. Our guest this morning is Greg Demore. He believes Dr. Cade deserves to be elevated in the medical canon for his discovery, and he's co-authored a book about him for that very reason. Good morning to you.
Good morning, Ellen.
Let's talk about John Cade. He was a born observer. He'd been observing mentally ill patients from his childhood because his father was a psychiatrist. So he grew up in their midst. How did that change his observation about people in the world?
That's right. So he was born in Horsham in country Victoria, and his father was a psychiatrist. And back then in the early 20th century, psychiatrists actually lived on the mental asylums. So John Cade, as a young boy, was taken from asylum to asylum and observed mentally ill patients every single day of his life. So instead of being objects of curiosity or people to fear, he actually regarded them as friends from a very early age, and that really shaped his whole attitude to medicine and psychiatry in particular.
The language of psychiatry was very different then to now, in a way that, a broken bone's a broken bone, and it would have been described in a particular way 100 years ago and is described the same way today. But Cade's father would have spoken about melancholia and
That's
things
right.
like this.
So melancholia is this kind of almost sort of flowing, almost romantic name, but in reality it's referring to what we now consider as severe clinical depression, where a patient, for example, in the early part of the 20th century might develop a severe depression and without any effective treatment may remain frozen and locked in that depressive state for perhaps up to a year, staying in an asylum until gradually the symptoms thawed and they might return to normalcy. That is, of course, if they survived that year.
Okay, and so what was available to Cade's father in the asylum in terms of treatment? Was it just down to ECT?
Well, no. So in the early part of the 20th century, there was no single effective medication. There was really no single effective treatment of any kind. ECT,
electroshock treatment.
Yes, shock treatment. That was only introduced in the late 1930s. So before that, there was nothing. All there really was incarceration, and patients were often deposited at the front gate of asylums in Australia by families and left for years.
And so what would father do with them? How would he treat them?
Well, he was a remarkable individual, John Cade's father, a very kind individual. He would try and treat them with good nutrition, try and make sure they got reasonable sleep. They had occupational duties on these large asylum grounds. But of course, many patients were agitated and threatening, and many of these patients had to be restrained in these incredible thick canvas, bone-coloured material, which sometimes there are records of patients being locked in these straitjackets literally for 72, 96 hours at a time.
You have your hands crossed over your chest, having to be spoon-fed.
That's correct. And I mean, one of the great offences in the early asylum days was for a patient to masturbate, because that was thought to be one of the causes of insanity in the early part of the 20th century. So those patients, men or women, had to wear muffs strapped around their bodies so that they wouldn't do or undertake such an offending activity.
So he's brought up in this very extreme setting. Then the war,
Yes.
the Second World War, he joins up, he's captured at Singapore, and he's sent to Changi. He spends the war
Correct.
at Changi. He's not sent off to Borneo or anywhere else, Thai-Burma Railway. What does he observe about the mental health of prisoners left behind at Changi?
This is really the key moment in John Cade's life. So you're right, he's in Changi for 3.5 years.
A prison camp.
Yeah,
a prisoner
POW,
of the Japanese.
Prisoner of war camp. He's there for 3.5 years. He's the only psychiatrist there. Now, the Australians and the Brits set up a hospital. They can't decide how to set it up, so they set up a British hospital and an Australian hospital. The Australians detest the British because the British are trying to run the Australian hospital. John Cade within that sets up a mental health unit, 10 to 12 beds, and he observes mentally ill diggers. And the key thing that he observes during those 3.5 years, Ellen, is that he comes to the conclusion that serious mental illness can be caused by biological changes, changes in the chemistry of the brain. And you have to understand that before World War II, Freud was very popular, Sigmund Freud, and it was long held that serious mental illness was caused by faulty upbringing.
It's your mother, basically.
Yeah, your mother. Well, perhaps mother and sometimes father. John Cade, while he's in Changi, observes a couple of patients who looks for all the world like the mentally ill patients he had seen before the war. However, when they did autopsies, they found physical causes for their mental illness. For example, in one case there was a blood clot on the brain. And so he started to think, thought, maybe illnesses like schizophrenia and manic depression, which we also call bipolar disorder, maybe there's an organic, a physical cause for it. And that idea took root and really incubated over the next 3 years until he returned to Australia.
And he comes back and he heads to a mental hospital rather than taking private patients or another psychiatric post, and he gets rather obsessed with urine.
That's right.
Why is he so obsessed with urine?
Yes, not the most romantic and interesting of substances one would have thought, but he comes back to the outskirts of Melbourne to an asylum. Now, it's an asylum where ex-diggers are incarcerated with mental illness. And he thinks to himself, well, I'm going to look at this condition called manic depression or bipolar disorder. And he has this idea that when you're manic or high, elevated, talking quickly, there might be an excess of a certain chemical floating around your body. But when you're depressed, there might be a deficiency. So he asks himself the question, how could I show that? And he thinks that maybe if he looks at the urine of these manic depressive ex-diggers, he might be able to find this substance. So he asks the nurses to collect the urine from all his patients at this asylum, and then he does something extraordinary. He collects this urine, and then he actually stores them in the fridge in their house, so much to the consternation of his wife. But John Cade was incredibly single-minded at this point. So collects all this urine, and then he gathers some guinea pigs, literally guinea pigs, the animal guinea pigs, and starts to inject urine from these patients into guinea pigs. And the hypothesis is this. He says that maybe the urine from manic patients, bipolar patients, is more toxic because of this substance he's after.
So we're looking to knock the guinea pigs off more quickly than the guinea pig from a mentally healthy person.
And that's what he finds. He says the urine from manic patients kills the guinea pigs quicker.
Oh dear. But what have you really proved at that point? I mean, other than
Nothing.
the fact that there's a lot of glass jars in the refrigerator, nobody quite knows what's in them, but do not drink, basically, and there's a lot of dead guinea pigs around. I mean, it doesn't sound like a very good beginning, does it?
Well, Ellen, you could be quoting his wife at this point, I would suggest. That's what she said to him, and she implored him, what are you doing? But he then has this idea. There are two elements in urine that could be causing this toxicity, urea and uric acid. And uric acid was the key. It's an acid, of course, but to manipulate that chemically, you have to add a substance in it to make it what we call a salt. And that's where lithium came in. If you add lithium to uric acid, you get a thing called lithium urate. That's something that's quite soluble in water, and you can make different concentrations of it. When he added lithium and then injected the guinea pigs with lithium solution, something magical happened. The guinea pigs became very quiet, very relaxed, and we have this wonderful interview with his wife we did some years ago before she passed away, where she remembers being called into this little shed by her husband, John Cade, and he said, "Look at this, Jean. The guinea pigs are quiet, they're relaxed, I can turn them over." And in that moment, he had this piercing insight that maybe if he gave lithium to one of the many mentally disturbed patients around him in the asylum, he might be able to relax them. And that was the leap of faith and science, if you like, that he made in 1948.
My guest is Greg Demore, psychiatrist and co-author with Anne Westmore of Finding Sanity, John Cade, Lithium and the Taming of Bipolar Disorder. So now we have some very relaxed guinea pigs.
Yes.
This was the 1940s and 50s. Ethics were a thing then too. Before he can publish anything, before he can inject any mentally ill patients, he has to ascertain whether or not this is a safe thing to do. How does he proceed?
Well, in that wonderful, timeless tradition of the Australian scientist/doctor, he decides to test it on himself. And he was a man of great honour. He was a very religious man, and he felt that he couldn't inflict a new substance on a patient until he swallowed lithium himself. So he took it for several weeks, didn't die, didn't curl up into a ball in the corner and didn't fit, and he decided that it was now safe to give to a patient. So he scanned the asylum. And there was one man in particular that he had known for a number of years, a remarkable individual by the name of Bill Brand, an ex-digger from World War I, who had been psychotic, mentally ill on and off since 1916, so over 30 years. And for the last half dozen years, Bill had been a patient in this asylum in Melbourne at Bundoora. He had become incredibly emaciated. He was almost like a feral animal. He'd fossick around the rubbish bins in the asylum. He would repeat sayings from World War I. He would repeat his serial number. He was manic. He would try and spend money. He would abscond. Everyone knew Bill Brand. And for some reason, John Cade decided to test lithium on Bill first. Bill's life was the quintessential life of the seriously mentally ill patient. He was homeless before he was in the asylum. He was abused by people. He worked in a range of poor labouring jobs, cut off the tips of 2 of his fingers in a labouring job. He was disowned and alienated by his family, and he was left alone in this asylum. And in 1948, in March, John Cade tested lithium on Bill Brand.
And did he do it because he felt so much for this man, that he had suffered so long? Or did he think, this man is so marginal to society, I can test something on him and no one will know and it won't matter if it goes wrong?
It certainly would not be the latter, because John Cade's moral compass was so clear. What I think the driving force was in 1948 was that there was nothing. This man was almost certainly going to die, a miserable death alone. In one sense, there was really nothing too much to lose if you tried a new substance such as lithium. And I think there's also that kind of mindset that John Cade had. He was an experimentally minded individual, and he was a very pragmatic individual. And he just thought, well, it's pointless testing things on guinea pigs. You've really got to take that next bold, courageous step. There were no ethics committees in 1948. He was only answerable to his conscience, and that he thought he had answered quite well.
So he's tried it on himself for several weeks. He's fine. Does he inject Bill? How does he get it into Bill?
So the way they would stir up a lithium solution, there weren't tablets back then. Now, of course, we don't know if he told Bill what he was giving him or told his family, but we do know in March 1948 he stirred this solution, gave it to Bill, instructed the nursing staff to watch him, and then slowly, over the next 2 to 3 weeks, something miraculous occurred. Gradually, Bill started to look after himself. His speech slowed down. He stopped fossicking about in rubbish bins. And after about 2 months, Bill Brand, notorious amongst the attendants at the asylum, returned to his normal self. And in 2 months, roughly, he walked out of the asylum as sane as you and I, Ellen, back to his old job. Nothing had been seen like it in mental health history before.
Mm. And so we have the eureka moment, but we also have the seeds of the sadness, the difficulty of mental health. It didn't end well for Bill.
No, and in many ways Bill's story is the archetypal story of mental illness and how we deal with it. Bill returns to his old job and then decides he's doing so well. He doesn't need medication, goes off the lithium, becomes very ill again with bipolar disorder and gets hospitalised. And this is where a tragedy, I think, unfolds. You have to understand that in the late 1940s, we didn't know how much lithium to give. John Cade didn't know how much to give. And lithium is a very useful substance, but you can only give a certain amount. If you give too much, the patient becomes toxic. When Bill returns, John Cade pushes his lithium harder and harder in a desperate bid to get Bill back to a normal mental health state. But in so doing, he makes Bill toxic with lithium. And then sadly in 1950, Bill Brand dies, the first person to die, first person to be cured of his illness, if you like, or with lithium, but also the first person to die because of lithium. And that profoundly rocks John Cade. He thinks for a moment that what has he unleashed on the world? And over the next decade or so, it's quite clear in the archives that he's uncertain as to where lithium will play out in mental illness.
When do we get to the point, as seen on the front of your book, of there's Bill with his horn-rimmed glasses holding up the pill? He's not looking triumphant, he's just looking like a man who's come to the end of a journey. When does the journey end and lithium enters for psychiatrists as something that can be given, not always a popular treatment, but can be given and is often very effective, a mainstay of mental health treatment?
Well, lithium is without doubt the gold standard for severe bipolar disorder. That's clear. 70 years later, it's still the gold standard. But it was a rocky course. Patients started dying not only here, some also died in the United States because they started using lithium chloride on their fish and chips instead of sodium chloride. Patients died in the US, they banned lithium in the United States. It was in the 1950s and 60s that a Danish psychiatrist took up the argument with lithium. He had a brother who had depressive illness, treated his brother with lithium. His brother responded well. And so this doctor, Dr. Skau from Denmark, evangelized about the value of lithium in the late 50s and 1960s. And he showed that if a patient with bipolar disorder stayed on lithium, once their depression and mania had resolved, it could actually stop the recurrence of future episodes, or at least thwart the recurrence of future episodes. And that was a key step. So by the late 1960s, early 1970s, John Cade's discovery is heralded as something that is really, truly triumphant.
And what about the man himself? He's not on a postage stamp. He's not as famous as Alexander Fleming, but his breakthrough is just as significant. Did he ever feel this ex-POW, this man who'd grown up with this great affinity and concern for patients with mental illness, that he was a pioneer, that he was, a brilliant man in medicine?
There's no doubt he was a brilliant man in medicine, but he was a reluctant hero. He was truly a humble individual. He often talked about what he learned from his patients. You know, when you look around the world today where every two-bit hero struts his stuff on the internet, here's John Cade, who does something remarkable and keeps it very, very quiet. When he wrote a book about the history of psychiatry, Ellen, after he retired in the late 1970s, there was a chapter on lithium. And in that chapter, he didn't mention that he was the individual who discovered the miracle of lithium and its management in bipolar disorder.
Well, thank you so much for bringing it to our attention. It's a wonderful book. Our producer, Steve Turner, was completely captivated by it, and it is an astounding read to find out about this gentleman, that he not only grew up in this way, survived Changi, but went on to make this breakthrough. Extraordinary, a very Australian story. Thanks so much for telling us about it.
Thank you, Ellen.
Greg Demore is the author. He's a psychiatrist and co-author, in fact, of Finding Sanity, how Australian psychiatrist John Cade pioneered the use of lithium to prevent bipolar or to treat bipolar disorder. You're listening to Life Matters.